Hello, welcome back to Care Zone. My name is Grace. Today we'll be discussing something about the patent and proprietary medicine dealers and you and I who are patients. How can this interaction be carried out in a lawful manner in Nigeria? If you have not subscribed to this channel, please take your time and do that now so that you don't miss any of my videos. The healthcare seeking behavior of Nigerians these days is to walk into a patent medicine store, popularly called chemist shop, and request for some medicines. Some persons even take it a step further by Googling their symptoms and getting suggestions on medicines that are used for treating certain ailments, while some get advice from health content creators on social media. So once they have this information, they just walk into a patent medicine store or a chemist, as it is popularly called, or even a retail pharmacy, and they request for a particular medicine without even discussing their reason for ordering that medicine. Many persons find it difficult to visit the hospitals. Some only go to the hospitals when there's an emergency, because these patent medicine vendors are easily found within their neighborhood, and the retail pharmacies as well are scattered around our areas. So before we continue, I would like us to clarify who a patent and proprietary medicine vendor, PPMV, is. These people are different from pharmacists. They are persons who have been authorized by the Pharmacists Council of Nigeria to sell only over-the-counter medicines. Over-the-counter medicines are medicines that you can buy without a prescription. So these persons are people without formal education in pharmacy, but they are licensed or authorized to sell pharmaceutical products for profit. So they provide certain medicines that are used for treating minor illnesses, and then they refer patients to the hospital for adequate medical attention. That is what the Pharmacists Council of Nigeria has authorized these persons to do. And all that is required to run this business is an O-level certificate, though apprenticeship with a licensed patent medicine vendor is an advantage. Also, being a nurse, a pharmacy technician, or having attended a school of health is usually an added advantage. So this tells us that among the patent medicine vendors, many of them are actually nurses, auxiliary nurses, pharmacy technicians, or people who have attended school of health. However, many of them are simply secondary school leavers, O-level certificate holders. And that is why the license that is issued to them is restricted to only over-the-counter medicines, and they have an approved list of medicines that they are authorized to sell in their premises. So we're having this discussion today because many persons do not know that there are certain services and certain medicines they should not try to buy from patent medicine dealers. Of course, it is understandable that there are controversies surrounding this subject due to regulatory issues in this pharmaceutical sector. Some controversies like the fact that many of the patent medicine vendors, especially the ones who are skilled, like the nurses, pharmacy technicians, feel that the regulations is making them constrained and limiting their scope of services that they can render to the public, especially in areas of treatment of common illnesses, STIs, and administration of injectable contraceptives. So these persons feel that they are skilled and able to do much more than the regulation is allowing them to do. But of course, like I said earlier, it is because even though some of the members of this team are nurses or pharmacy technicians, the requirement is just O-level, and some of them who are actually engaged in this business are simply O-level holders. Another challenge is that many persons avoid going to the hospitals for treatment. They avoid the private hospitals because of the high cost of medical treatment or care. And for the public hospitals, people are not happy to wait for long hours before they get attended to, and many of these hospitals are understaffed, under-resourced, and they have some cumbersome record-keeping habits or protocols that turn off the patients. So many persons would rather not go to any hospital, and they would rather walk into the nearby patent medicine shop or a retail pharmacy to get treatments for their ailments. So for these patent medicine vendors, it is quite challenging when they are restricted to just selling over-the-counter medicines, and most of the people who come seeking medical attention are actually requesting for things that are beyond their scope of practice. And you find that some of them are actually tempted to begin to stock things that are beyond and render services that are beyond their scope of practice. This is actually a big gap, and we hope that someday it will be addressed by the governmental authorities and the regulatory bodies assigned to this sector. But until then, it is important for both the patent medicine vendors and the patients to remember that in seeking or administering health care to people, most persons or nobody really knows what the law says until something bad has happened. When a complication has occurred or a life is lost, then you would know, you would see that almost everybody knows the law, and the long arm of the law would definitely catch up with a person who contravenes these regulations. So I always encourage patent medicine vendors to stay within their limits, even though they have the skills to do much more than they actually are allowed to do, until when these issues are resolved. So here are some things that we should not ask a patent medicine vendor to do for us. The first on the list is, do not ask them for antibiotics. Antibiotics are prescription medicines, and they are not approved for patent medicine vendors to sell. Before a doctor issues or writes a prescription for an antibiotic, investigations must have been done. Even the microorganism that is causing the ailment may have been tested in order to be sure of the appropriate antibiotic that can fight that particular microorganism. So do not go asking them to sell antibiotics to you. I'm talking about simple ones like amoxicillin, ampicillin, ampiclox, flagyl, tetracycline, and the rest of them. These are not approved for sale by patent medicine vendors. Secondly, we should not ask patent medicine vendors to cut sachets of medicines for us. We should not also tell them to mix medicines or tablets for us. This practice is very rampant. Some persons, after a long and hard day's work, would walk into these patent medicine shops and ask them to mix tablets, pain relief tablets, and capsules for them. And when these things are done, it predisposes people to adverse reactions, drug interactions, and even to new ailments coming up. For example, a person who continuously takes pain relievers may come down with an ulcer, and many of these persons may not even have a good meal before, and they may not even be advised to take a meal before taking these medicines. Another thing we should not ask patent medicine vendors to do for us is abortion, wound treatment, birth assistance, and fertility treatment. You see, there's a reason some persons they attended institutions of higher learning and spent years studying the reproductive system in order to become specialists. We call them gynecologists, and these persons are specialized in the reproductive system. So they are trained, and as a result, they are licensed and are responsible for their actions while rendering services to the public. These are the kind of persons we should take our reproductive issues to, and not the patent medicine vendors. When a person patronizes these persons for birth assistance or for wound treatment, complications may occur. A wound may finally not heal and may become septic, and more issues would come up. At this point, that patent medicine vendor may be unable to handle this, and loss of life may happen. So this is why it is dangerous to ask them to even render such invasive services to us. So the best thing is to go to the hospital and have these issues treated by the specialists or the qualified doctors. So like I said earlier, some of them might say, I'm a nurse, I can do it. I'm a pharmacy technician, I can do it. But the environment within which these things are being done is not ideal, and complications that may occur may not be easily handled by these persons. And what is more, it is not within their license to practice these or render these services to the public. So these are the things we should consider before asking these persons to render such specialized services to us. So what do we need to do? As patients, we can still patronize our patent and proprietary medicine vendors. They were established to assist in providing healthcare to some extent in areas where healthcare is somewhat inaccessible. And they also help in the urban areas to augment the services of the retail pharmacy shops. However, whenever we have health issues, we should visit the hospital, have our issues evaluated and investigated properly. We should go to the nearby pharmacy and present the prescription. The pharmacist will advise you on how to use your medication. And even if you run into issues while using the medication, you can still go back to that pharmacist and make complaints. However, you can still get simple medicines like your multivitamins, some analgesics, paracetamol, some pain reliefs, and other medicines that are within their approved list of medicines to sell. So the patent medicine shops, of course, will let you know if you ask for something that they don't have. It is expected that this is what they would do. But however, this video is meant to educate you also as a patient to know that there are certain things that are not lawful for you to request from a patent medicine vendor, and there are certain services that a patent medicine vendor should not be rendering to you. Should complications occur or should issues arise, these practices might actually lead to lawsuits or some other big problems. So till I see you in my next video, continue to stay safe and stay healthy. I remain Grace Ogbonnaya, your pharmacist and health coach. Remember to subscribe to this channel if you have not done so. Bye.